Hello and welcome to the show. Dr. Tony, we are so happy you took the time to be with us today.
Thank you so much for having me. I'm excited to be here.
Yes. And again, this is every once in a while I pop on one of these topics that seem a little sideways when people first look at it. But, everything about our health is connected. And this is a good example of that. Oral health, and you specialize in biological dentistry. So we're going to, and we'll start right there if that's okay. If we could just understand. So, what's the difference between biological dentistry and the drill and fill model that we're kind of used to,
Yeah.
having those biannual appointments for?
Yeah. So biological dentistry, it's really going philosophically, we are looking at the human terrain. There are two different schools of thought. There's the germ theory of disease, which is fantastic. It just says that, a specific germ causes a certain illness, and so therefore you take away that germ, you take away that illness. And terrain theory is saying, well, no, the health of the terrain of the human body. So our whole body health is what is needing to be optimized to resist disease and to be as healthy as possible. So in biological dentistry, we are making sure that nothing in the mouth is contributing to other illnesses within the body. And then anytime we can, we're treading lightly. So we focus a lot on prevention and nutrition. I really like minimally invasive techniques. So it's a kind of a less is more philosophy and looking at the health of the whole body.
Yeah, I love that. And I mean, the statement you just said, the health of the whole body. So so if somebody is going to a biological dentist, does it usually start with our regular general dentist practitioner that we're seeing, again, for the preventive maintenance? At what point does somebody maybe switch over or realize that they need a more intuitive approach to what's going on inside the mouth, basically?
Yeah. Well, I think that my colleagues, traditional dentistry is just really fantastic at being able to restore the function and the structure of teeth. We've become really, really good dental surgeons or tooth carpenters,
Right, right. It's a good
if
way
you
to say
will.
it.
But sometimes we forget the other things. We forget about the health of the mouth, or maybe we forget to focus on it as we should. So a lot of times patients will come to me or come to my office when they are looking for things that maybe my colleagues aren't. If they no longer want to use chemicals that we know have potential to harm, like fluoride, like mercury fillings, things like that, then a lot of times they'll come to me because their values no longer support traditional dentistry. So we have a completely fluoride-free practice. Excuse me. And those old silver fillings that most of us got when we were kids? We want to make sure that if and when those need to be replaced, that they're done so very carefully because you actually do get mercury exposure. You get a little bit of mercury exposure just having them, but you get a huge exposure to mercury when they are removed
Mhm.
without certain precautions in place. And so a biological dentist is going to take those precautions with those types of materials, whereas a colleague who's not trained that way does not take those precautions. So
Yeah.
those are typically people who are coming to me, those who don't want to use fluoride, those who want their mercury removed safely, and those who are looking for hidden infections that they have a hunch might be contributing to health issues.
Yeah.
Infections in root canals that are often not seen, infections even where old extractions happened, like where those wisdom teeth were removed a couple of decades ago.
Mhm, mhm.
Those can cause potential issues too. So it's usually patients looking for those things.
Yeah, yeah, I love that. And so, and you just tapped into this, but the dental materials and what you're talking about, obviously, it's the infection from the root canal. This is something that's very timely for me because I'm hearing more of friends and people in our friend circle that are recognizing some issues or they're questioning root canals and
Yeah.
whether or not it's really the proper or the the necessary steps to take and just understanding again the whole procedure and really what the risks are associated with that. And you mentioned the mercury. Could these, whether it's the removal, like you said, where it's carefully done, the mercury, can they trigger or cause autoimmune disease? Is there any correlation with that?
Well, we know that there's definitely a correlation between certain neurotoxins and certain illnesses. So can I say as a dentist without having some backlash, can I say that your filling causes XYZ illness? No, I cannot. But what I can say is that mercury is a very, very potent neurotoxin, and mercury toxicity is correlated with multiple chronic health issues. And then just anecdotally in my practice, I have seen patients who have they've worked with their functional medicine provider, they've worked with other healthcare team members, and after removing the mercury from their mouth and from the rest of their body, they do have a resolution of symptoms oftentimes. So
Interesting.
uh, it's odd to me still that dentists have to be careful with what we say around this.
Right.
But
Understood.
it is clear that mercury is not good for us. It is a neurotoxin.
Yeah.
The exposures that we've had to mercury over time, like I think we live in a much more toxic environment than we did 50 years ago.
Yeah.
And so I think all of these things combined are really impacting our health cumulatively.
Yeah, yeah. It goes back to that amazing word you use, which is the terrain. So the terrain has changed.
The
I mean, our
terrain has
body,
changed.
I mean, yeah, yeah. I mean, our body was created the same. That's not something biologically we're the same, but it's the outside things that are really making it a lot harder. Yeah, it's interesting, really interesting. So how does oral health connect to the gut microbiome? And I know this is something you're really interested in, and this is why you do what you do. And do you have a personal story that you'd like to share? Is there a reason that this area of dentistry is really what spoke to you, and if it has anything to do with the gut microbiome by chance? I don't know. I'm just assuming that. I don't know.
Your hunch is correct. Because man, I just wanted to be a normal dentist. I didn't want to do this.
Interesting.
But God had other plans, and I'm
You
so
did.
glad that he did, because I can tell you that the traditional, you said it, the drill, fill, and bill model of dentistry was not fun for me. It was not rewarding, and I probably would not be practicing if that's still what I felt like I had to do, because I wasn't getting people well. So this kind of came on my radar because I myself got sick. I was working full time. I had a toddler at home. I was building my first practice from scratch because I only like to do the things the hard way. I don't like to do things the easy way, apparently. And, it was in an area where I wasn't eating very well. Obviously, I wasn't sleeping very well. And so I started having just a ton of gut issues. And finally, I was able to convince my doctors to take a further look, and was diagnosed with Crohn's disease, and was given a very standard answer to that was, okay, here's your diagnosis, here are your medications. You're going to take these for life. And oh, by the way, there's about a 40% chance you might need surgery at some point to remove part of your colon when the medications stop working. And I just did not accept that answer. Yeah, I was 30 years old. I was just opened this business from scratch that I was obligated to run and make successful. So I just went down all the rabbit holes, went on this journey myself. At the time, I didn't know anything about functional medicine. I didn't know anything about integrative medicine. It was just me and my computer trying to figure this out at home. And so as I learned what triggered the autoimmunity for me, I actually did start to feel better. But as I was learning these things, just like you said, like I realized that Crohn's disease, it's all about inflammation and a dysbiosis in the gut. Well, goodness gracious, what do I treat in my office every day?
Right.
I treat tooth decay and gum disease. It's all about inflammation and a
Mhm.
dysbiosis in the very first part of your gut, which is your mouth.
Mhm.
And so I knew that as I started feeling better and I weaned myself off the medications with the help of my doctor, have been in remission for over a decade. As I was learning how to actually heal, I knew that I had to be able to figure out how to do the same thing with my patients, how to help them heal from tooth decay, from gum disease. So, just a ton of correlations there. I'm thankful for my illness. Obviously, I'm very thankful for the remission of my illness, but so thankful that it kind of brought me on this journey because it is so correlated. And the more I learn, the more I learn just how related these things are. Um, Crohn's disease is autoimmune, and we don't really think, just like type 1 diabetes is autoimmune, and we don't really think of tooth decay and gum disease as autoimmune. Like it's a similar mechanism
Mm.
as autoimmunity.
Yeah.
Um, and so much so that we can see in the research that they are connected directly. So if you're type 1, if any autoimmune condition is out of control, then that will often show up as more inflammation in the mouth.
Yeah.
A dysbiosis in the gut. If your gut's not well, you're not absorbing nutrients, your teeth are not going to do as well. So, whatever the path of least resistance is for you and your body, that's where these imbalances are going to show up. For me, when things are out of balance, it shows up in my gut and in my gums, believe it or not. For other people, I have not had issues with cavities, thankfully, but for other people, their gums are doing just fine, but man, things get out of balance and they start getting more cavities.
Mm.
So I think all of us just need to, and as we get older, these are things that we learn about ourselves anyway. We
Yeah.
learn, okay, when I'm not sleeping well, here's what happens. When I don't drink enough water,
Yeah.
here's where I feel it. And we start to learn what works well for our body and what doesn't work well for our body. And then that's where things get fun. Like that's where we can really start to foster wellness in ourselves is when we start to learn where the imbalances are for us.
Mhm. Yeah, yeah, just paying attention to the feedback.
Yeah.
And I'm sure you can agree symptoms are a pain in the neck, but it's the body saying, "Whoa, wait, pay attention." So,
Yes.
I like that. And a lot of this really does tie into our listeners. Like you mentioned, type 1 diabetes, a chronic disease, inflammation, and also going through perimenopause. And all of this it is very much connected to the gut microbiome. Something that's not talked about a lot is how, again, when the falling hormones or blood sugar that is not in a healthy range, it tears up our gut. And like you said, that's either going to reflect in the oral health or maybe it begins in the oral health and it's just a trickle down effect. I guess we don't know if it's the chicken or the egg or whatever it is, but just like you said, we just got to pay attention. We got to stop, recognize what's not feeling right and being able to talk about it. Yeah, for sure. Yeah.
And this was like, if nothing else, I think the primary lesson from me getting sick was what I think a lot of us in America struggle with so much is things were feeling off, but I was young and I was busy and I didn't have time to pay attention. I didn't have time to force myself to stop and rest. And so as I was figuring out how to get well, it was like you have to actually create the space, create the bandwidth in your life and in your schedule. If you feel bad, you need to sleep.
Yeah.
If you're hungry, you need to stop and eat. If your blood sugar is out of balance, you need to take the time to be able to make those corrections in real time. And I think so many of us, especially when we're in our 20s, 30s, 40s, we're terrible at taking the time. And especially in the States, like in the Western world, where we're not exactly great at that.
Yeah, yeah. Let's switch over and talk about fluoride. This is a kind of a hot topic too. There's some communities that are actually, because some water treatment, and I am not an expert at what communities are doing with water treatment. honestly should take the time to learn more. But I know some of them are putting fluoride in, and then you get the announcements they're taking it out. But within the dental practice, I mean, we grew up where we had fluoride toothpaste, where we were getting fluoride treatments. So what is the, again, the good, bad, and the ugly about fluoride, and what should we know about that?
Well, here's what I can say, where I agree with my colleagues. Fluoride is an effective tool. It's one effective tool that can reduce the risk of tooth decay. Depending on the study you look at, it can reduce tooth decay anywhere from 20 to 40% about. It is most effective topically rather than systemically. So the most effective fluoride is fluoride that your teeth are physically exposed to. It is not very effective just by ingesting it and it being in your system. So that's where my colleagues and I agree. There have been more and more studies more recently that are showing that maybe it's not as safe as we once thought it was. And that's where we start to differ, because the studies that are coming out, yes, they are new, but they are compelling stories. I was taught that, first do no harm and informed consent and, medical freedom. People should have, agency to choose their medications and
Yeah.
treatments and so forth. And there are several things that are happening when the government entity, and it's not, some big vast conspiracy. I don't think this is,
And
dentists have said that fluoride is good. So therefore local governments add it to the water when it's convenient and cheap to do as a
okay.
way to help treat cavities. And dentists, the CDC, like all these government bodies have said that this is a good thing. In my mind, I have ethical issues with that because it is added in order to treat and prevent cavities, to which no one has consented to. So it is a medical treatment
Mm,
without consent.
interesting. Yes, yes, yes. I like
Yeah. When it's in the water supply, we actually can't control the dose. So a 70-year-old man who drinks 1 glass of water a day when he's thirsty, the dose that he is getting is vastly different than the dose an infant is getting who is drinking primarily formula mixed with tap water. Vastly different doses, and we can't control it.
yeah.
Because when it's in the water supply, it's actually everywhere. So every manufactured food, any food or drink, if it's in a bottle, a can,
Yeah.
a box, anything made with a municipal water source that's fluoridated is going to have fluoride in it.
Interesting.
And we can't control that.
Yeah.
So when we can't control the dose, it is a medication without our consent, even though, they would argue that it's naturally occurring. Well, it's not naturally occurring in the way that it's given to us. So I have real ethical issues with it. And you combine that with the fact that according to more recent research, we actually don't know the dose that's safe for everyone. So if we don't know how much is safe and how much is going to start causing issues for people, then in my mind, we should not be using it
Yeah.
until we really can know and be sure. Guessing that most of your audience is not aware that there was actually a lawsuit that said this very thing. And it's a recent lawsuit, was recently completed just last year. I guess this year, because we're almost at the end of 25. The lawsuit was against the EPA. So this was a very large lawsuit. And the judge in this case said that based on the current evidence that we cannot tell what dose is safe. And it's the EPA's job to make sure that what's in our environment, what's in our air and water is safe. And so the judge ordered, the judgment is that the EPA has to address this, but they did not say how the EPA needs to address this. So these nonprofit groups that are concerned about fluoride, they won the lawsuit, but now it's on the EPA's task list with no timeline, there's no deadline
Okay.
and there's no direct outcome that the judge ordered. They just said that the EPA has to address fluoride in water some way, somehow.
Okay. Okay.
So until then, and that's why you see with the new administration, RFK Jr. has been
Yeah.
questioning fluoride for many years
Uh-huh.
since before his current position.
Mhm.
And that's why you're seeing states and different municipalities that are now choosing, in light of this new evidence and this new political push, to go ahead and stop adding it to the water. They're not removing something that's naturally there. It just
Okay.
stop adding it to the
Okay.
water supply.
Yeah. Yeah. So at this point, for us, for all of us, what should we be looking at or asking within our own communities? And as far as, I mean, because you said that there are some, you said topically fluoride does help, systemically it doesn't. And then the water, you say that a lot of us, a lot of the water supplies are, are treated with it or added to it. So what are there, so how do we get the benefits without the downward spiral of risks that might lead to other periodontal, disease or really systemic disease or
Systemic issues.
yeah,
Well,
yeah.
and the risks are, so there are risks for us in our age range because fluoride does compete with iodine in the thyroid. So there are concerns around thyroid health. There are concerns around the health of the pineal gland that's in our brain. And then the most compelling recent studies are studies around the IQ of our children. So, and these are very well done, well researched studies that are correlating increased levels of fluoride with decreased IQ in our children. And
Okay.
this is maternal fluoride. So fluoride that the
Okay.
mom is ingesting that's impacting the IQ of our babies.
Wow. Okay.
Huge concern as
Yeah.
for me, as far as I'm concerned. So for that reason, I really feel like it's important to filter it out of our water if we can. And that's the best way to do that is with a reverse osmosis
Okay.
filter. It's not going to be filtered out with a carbon filter, like a Brita filter. Those won't get fluoride out because fluoride's a really small particle. If you want to still get the benefit, then I would say take it out of the water and you can still use it in your toothpaste if you choose to. That
Okay.
way you're getting the topical effects. But I will tell you, you don't need fluoride to have healthy teeth. And because we're exposed to it from every direction, because it's in the water, you're still getting fluoride whether it's in your toothpaste or not, because you can't help but get it when
Yeah.
it's everything.
Yeah.
So, fluoride is not an essential nutrient. It's not necessary for healthy teeth. And we have other tools in our toolbox now that are showing to be as effective, if not more effective, with a better safety profile. So, ingredients that you could focus on instead are ingredients like xylitol, which is a plant based sweetener. And if
Okay.
you get regular exposures of xylitol, then that has just a dramatic impact on cavity risk.
Hmm.
And then there's an ingredient called calcium hydroxyapatite, which is exactly what our enamel is made of. Our enamel is made of these hydroxyapatite crystals.
Okay.
And it is now an ingredient in toothpaste that is showing to be very, very effective at remineralizing teeth. And both of these ingredients, xylitol and hydroxyapatite, have just an excellent, excellent safety record and have been used for a very long time with virtually no negative health impacts at all.
That's really interesting. Yeah. Yeah, yeah, those are the two things that I've heard of, but I didn't really understand the correlation, obviously, with oral health. So, and you're saying that there are some toothpaste and, well, toothpaste. I'll call it toothpaste. I haven't even asked you about rinses, which is oral rinses, because I have a feeling you have an idea about this one too. But so we can find these toothpaste that have this added. So this could be a nice way to get it.
Yes.
Okay. So topically, so that our body can get the advantages of it using it topically. Yeah. Okay. So what about the mouthwashes? We grew up with that bottle on the counter, right?
I know. The big blue bottle
Yeah.
that makes your mouth burn afterwards, and if
Hmm.
it's burning, you know it's working.
Yeah.
Yeah, I was addicted to the stuff in the big blue bottle early. Like before I went to dental school, I worked as a dental assistant in an office for a year after I graduated from my undergrad and was, trying to decide whether I wanted to go to dental school or not. And so I would like in between every patient, I would run by and the dental office had the big, like jumbo size pump bottle, bright blue and bright green, wonderful chemical goodness.
Yes,
And I would take a
yes.
couple of pumps of that before every patient. So, what we know about these strong mouthwashes is many of them, including, the big brand names that you're used to seeing in the stores, have usually a ton of alcohol. They're usually very, very acidic. So, they may be great at killing some of those gum disease causing bacteria, but they're also killing good bacteria and they're so acidic that if you're prone to cavities, they are not doing you any favors
Good to know.
because they're so acidic, like as acidic as a can of soda.
Interesting.
So
Wow.
so it's really like the equivalent of Roundup in your mouth.
I like that comparison.
And what we want to be
Yeah,
using, like we want to be gardening with our hands instead of using Roundup in our garden, right?
yeah,
Like you don't want to
exactly.
kill everything. You
Yeah.
just want to eliminate those that are bad. So most of the time, for most people, it's not a good idea to use mouthwash on a regular basis. However, you can I like the physical nature of rinsing with something that can be therapeutic as an adjunct to brushing. And so with my patients, we choose rinses very strategically. If we're using something like if we need to kill some bacteria, then we'll use a very strategic antimicrobial focused on their specific bacteria and we'll have them use it for maybe a couple of weeks and then we'll stop.
Okay.
And then we'll add some probiotics back in to make sure that we're repopulating the oral microbiome
Yeah.
with the good bugs that we've
Yeah.
just had to kill in
Right.
order to get rid of some of the bad bugs.
Okay.
So traditional mouthwashes, I don't love, but some mouthwashes, and I never like for my patients to use anything with alcohol in it,
Okay.
regardless.
That's good to know.
But we'll use some mouthwashes strategically for a period of time.
Yeah, yeah. Again, it goes back to the terrain because the strategy around using a mouthwash, just like you say, is very specific. And I like that you have a timeline and there's a reason why, and there's a reason to stop because again, we're recognizing that maybe things were back into a healthy microbiome balance. So really good. What do you have anything else that maybe we didn't touch on today that I could that we could expand on? I know there's a lot of different areas. We didn't talk too much about hormones quite yet. And I know we tapped a little bit on type 1 diabetes again about how important this is just another motivator. I think, if and when our average blood sugar, our A1C is starting to kind of creep up and we're paying attention to those other symptoms. And then if we're aging and then, we're realizing that hormones are affecting the terrain. I love it. That's my word of the day. Affecting the terrain because it's so important. But when should a woman be looking at this as well? Or is there anything specific that really should raise a flag when it comes to the symptoms that she should be paying attention to?
Well, it's interesting as our hormones start to shift in perimenopause, we'll get this pretty dramatic drop in progesterone and then the drop in estrogen that follows. And both of those can have a pretty dramatic impact on our oral health. And again, if that's already your weak area, this is a time period when it'll start to show up. So we'll see often a decrease in saliva. So decreasing in hormones will decrease the salivary flow as well. I know I've noticed dry eyes. Many people notice dry mouth as well. It's like everything dries out
It
in
does.
perimenopause and menopause. They're so fun. My mama did not tell me that. I was not warned of this.
Many of us weren't. Right.
But all of our wet parts tend to dry out. And that can have a huge impact on oral health. That
100%.
alone can cause some inflammation in the gum tissue and tip the scales towards gum disease. And when we tip the scales towards gum disease, we will have a harder time controlling our blood sugar, controlling any autoimmune condition. And then diabetes is super fun because it's so correlated to our cortisol levels. You get some inflammation, then your cortisol starts to go up. And then when your cortisol starts to go up, then your blood sugar is affected even more. And it's just this like super icky cycle where your mouth is inflamed that makes your diabetes harder to control, which makes your mouth more inflamed. And around we go. So, yes, a lot of times we will start to see these issues pop up as our hormones change in perimenopause and into menopause.
Yeah. So what comes first? So like, so for instance, if you're getting, let's say, and if you have examples of maybe patients, definitely protect their identity here. But if you have an example of, say, a woman in her 40s that came in, and do you pinpoint that correlation yourself and ask these questions, maybe an intake form, to learn more about her health history in order to really, again, look at the whole terrain of her body to really, to give her a lifestyle protocol? Is that how you do work with your patients, I'm assuming?
Absolutely. So when we're with a new patient, I always like to test their saliva, to test their oral microbiome to see specifically which bacteria is there and what's out of balance, what we have too much of, what we don't have enough of. And so if there is something that needs to be corrected dentally, then oftentimes we make those corrections in the mouth, and that can start to have a positive impact on their hormones. It makes the functional medicine doctor's job easier. And
Yeah.
that's what we want to do. We want to make your doctor's job easier. But for patients who are normal patients and have been coming for a while, we're always checking
Yeah.
the gum tissue and checking the health of the mouth to see what's going on. And then we start to do a little bit of digging. We'll notice, oh, you're bleeding more in this area than you were last time. And I don't see plaque or tartar buildup as the reason for it. When I am looking and I don't see a dental reason for inflammation, then we're going through the checklist of the most likely systemic reasons
Okay.
that
I like
could
that.
be. And then we're having the conversation, depending on how old she is. Like, okay, how are you sleeping? What's been going on with your hormones lately? How are you feeling? How close are you to your cycle?
Hmm.
If it's a younger woman who's still, in the peak of her childbearing years, then when's your period? Because that will impact
Okay.
how her gums look too.
Oh, okay.
We're asking all of these questions. Do you have acid reflux that you know of?
Mm.
Because that has a huge impact. So, lots of clues that the mouth will give us to dig in further. And then it becomes just a really good opportunity to make sure that we're on the same page with the patient's other providers.
I like that. Yes, yes, teamwork, yes. And you realize that you're all trying to get to that same root reason, and for long-term healing. I like that. Now, is it possible to reverse periodontal disease through non-invasive, again, the surgeries, all of that, using whole body protocols? It sounds like this is definitely something that you're an expert at.
It is absolutely possible to reverse gum disease. However, depending on the cause of it, sometimes it does take dental interventions. And like you, we start with what's going to be the least invasive but most effective first. So if you have tartar buildup that's below the gum line, it may not be to the point where it needs surgery, but it may be that we have to do like a deeper cleaning. We have to make sure that we clean the area, remove that buildup, plus all of the other healing methods that we talked about, the nutrition, the protocols, all the
Okay.
things in order to heal. Because the buildup itself, like that hard buildup that you can't get off with a toothbrush or floss anymore, it's like a splinter underneath the gum tissue. And if you
Okay.
don't remove the splinter, then it's not going to heal no matter how many gels and rinses
Yeah.
and gadgets you use on it.
Right, right. Nice. Now, is there any over-the-counter oral care products that best align with biological approach, and which ingredients should we be avoiding? This is something that we should be really paying attention to. Yes.
Yes. So, in my opinion, the cleaner the better. And the more sensitive your system is, the simpler you may need to get. So it really could be as simple as a toothbrush with water and then rinse with salt water. It could be that simple. And I do have patients who are, very chemically sensitive, and we get down to basics, and just whatever they can use is what they can use. If we just want, like, if things are going okay and we just want to know, like, what's the worst icky stuff that we need to avoid, then I would say the worst icky stuff are the antimicrobials, and that includes fluoride. Fluoride is an antimicrobial. It's alcohol. It is a chemical called triclosan or triclosan that is like basically a pesticide that they put in some dental products. And then the things that are unnecessary, like the dyes, the artificial sweeteners, those things are
Mhm.
unnecessary in your dental health products. Preservatives are often, we would prefer to avoid if at all possible.
Okay.
But mainly it's just the really strong chemicals we want to
Yeah.
avoid.
Yeah. You mentioned alcohol earlier too, so that sounds like it's very harsh. Yeah, that's definitely something that's gonna mess with just the natural microbiome balance of the mouth. So really good.
And it's tough too, like from a manufacturing standpoint. It's not that I think these are evil empires out to get us,
Yeah.
but they have to create a product that can last on the shelf a certain amount of time. And most of the time, in order for them to make something shelf stable, it either has to be very acidic or very alkaline. It can't be neutral like water, but our
Okay.
our mouth really likes things that are neutral like water.
Right. Right.
So it's all a balance. That's
Yeah.
why we prefer not to use them for a long period of time if we can.
Okay. Buyer beware. Ask questions for sure. Yeah. I have a question. Baking soda.
Mhm.
Is that
Grandmothers used it,
Yeah,
right?
I know, and I will say I actually use that, and I'll share this online. I make a paste, and this was a friend of mine that worked for a dental office. It was not a biological dentist, but she gave me this tip as far as teeth whitening. She said peroxide and baking soda. Just make a paste, and then just kind of use that as like a little scrub, with a soft washcloth. So I do that. That's what I do just to kind of clean it up, in between cleanings with the dentist. But what are your thoughts about that?
I love, love, love this because this is where, again, sometimes simple is best. And baking soda is very effective. And baking soda is an alkalizing agent, it makes the pH higher. So, in terms of, trying to balance the acid base level in the mouth, which is what we want to do, baking soda is a really good tool for that. And you'll see it as in case you don't look at ingredients all the time, you won't see baking soda in the ingredient list. You'll see sodium bicarbonate in the ingredient list. So sodium bicarbonate is baking soda, and that can make the pH of a product higher. It can make the pH of your saliva higher, which is great. Now,
Interesting.
there are caveats. So the baking soda and peroxide as an occasional whitening agent is great. I have no issue with that at all, especially if you're using food grade hydrogen peroxide, just so it's a little bit cleaner. Baking soda itself can sometimes be too gritty to use all the time. So some people will notice that if they're using it really frequently, they'll get some gum irritation. It can actually, if you're using it every day, twice a day, can cause a little bit too much abrasion to the tooth enamel that I would prefer. So I would say if you're going to use baking soda, and yes, using it as a paste is perfectly fine. I approve, approve, approve.
So, I'd love to
But
hear this.
ideally, I would say once or twice a week
Okay.
is
Yeah.
all I would want you to do. If you are, again, I see a lot of very sensitive patients who we have to really pare down the ingredients. If you want to use something that is a powder form and use it more frequently, then sometimes bentonite clay or activated charcoal can be a little bit finer of a powder and a little bit less irritating to the gum tissue. So maybe alternate, but if you can, try not to do the powders twice a day, every day, just as a general rule, unless you
Sure.
really know that it's not super abrasive.
Awesome. Thank you so much. Yeah, that's some really good tips and advice. I appreciate that. Now, do you have any final takeaways for, again, the women listening today who obviously and we should be going to our dentist on a regular basis. So, is there anything specifically that maybe women with diabetes who are transitioning into menopause, just some takeaways, some things that they need to be paying closer attention to? Just to better to understand, this transition and how oral health is so important. Yeah.
It is so important. And this is not just the holistic woo-woo people. Like, it is very well documented in the research that the better health your mouth is in, the better you're able to control your hormones and your diabetes. So it is absolutely crucial to make sure that you are taking care of your mouth. And I would say, especially for diabetics, gum disease is sneaky. Where sometimes cavities, eventually you'll see them. Gum disease, I feel like it is able to progress a lot more before you notice it. So I think it's really, really important. I like for diabetics to go more than twice a year
Okay, that's good to
to the
know.
dentist, to have all of those measurements done around the gum tissue to make sure that things are in check. And if you don't have a biological dentist that's close to you, then my colleagues are all happy to see you. And every good dental hygienist, even if she's using things that I don't necessarily agree with, she's still going to be very good at assessing for gum disease and gum inflammation, which is just critically important for all of us
Mhm,
because
mhm.
things will change in our
Yeah,
40s and 50s. Our bodies change whether
absolutely.
we like it or not.
Yeah, yeah, yeah. Really appreciate all this. And it really is about knowledge and just being aware. I think the number one thing is just realizing how important this area of our health truly, truly is. And to spend, I know we can feel overwhelmed with all the doctor visits and the checkups, but again, preventive because you and I are aligned in that way. It's really staying on top of it rather than putting the fires out with, any sort of dental surgery that may be, suggested in the future. So we definitely want to do all we can to help prevent that. So awesome. I appreciate this. And I know we just touched on the topic because there's a lot of little ins and outs that we could have dove into, but this is a great introduction. And I think it's just spreading awareness to the women here. And so, where can our listeners, Dr. Toni, how can they learn more about Flourish? Love the name, Dental Boutique. And how can they connect with you?
Absolutely. Well, I'm so thankful for all of your audience. Like, if you made it this far and
Yeah.
haven't turned it off because I'm a little too holistic for some people, then we've done our job.
Mm.
I'm active on social media, probably more so on Instagram than anywhere else. So my Instagram is at Dr. Toni Engram, just my first and last name. And my practice is in Richardson, Texas, which is just outside of Dallas. And we have patients who travel all the time. So if you're not nearby, you don't have somebody nearby, then we're happy to see you and can help you arrange travel plans and that sort of thing.
Nice.
But the website to the practice is www.flourish.dental.
And I will link I'll write that here in the show notes. And do you have maybe you have some free resources that might be on your site that they can maybe get started with?
There sure are. Yeah, on Instagram, on our link in bio and on Instagram, we've got lots of free resources for you.
Awesome. Yeah, because again, I know this is a lot to take in and kind of put into your own daily, whether it's your daily practice, your future with your dental health. But it's always good to know this and just share it with other people too. This is something that a whole family needs to be on board with. Yeah, awesome, good stuff. I appreciate your time today. And again, we will link all of Dr. Tony's information right here to make it easy for you. And reach out with any questions. I'm sure she'd love to hear from you as well. Enjoy your day, and we will be back in here same time next week. Bye for now.